So when you look into the future, certification has to reflect all of those changes that we anticipate seeing in medicine. We're going to continue to have to emphasize things like good communication and knowledge of medicine, but we're also going to need to recognize that physicians need to be competent in information technology. They're going to need to be competent in delivering care in a lot of remote settings that we aren't necessarily looking at. And of course, we're going to have to be able to assure the public that we can deliver high quality, safe care in all of these settings. So I think certification is going to have to evolve to take that into account.
There are new things like interprofessional care that I don't think we've ever really focused on that are going to become very important. As the world becomes more global, there may be new issues of health or new issues in diagnosis and management that we're going to have to be thinking about. I think what assessment looks like, what learning look like, are going to be very different, and that has tremendous implications for the board certification world.
My guess is that from practice itself, with universal EMRs and better abilities to mine the data in accurate ways, we'll really be looking at, do physicians in practice actually practice what we believe they were taught? Can they practice in teams? How does the team function? I'm sure that the data people will be able to tease out the team as a functioning entity.
Increasingly, we're trying to develop tools and ways of assessing communication skills. These are all part of good doctoring. And if we want to achieve patient-centered care, coordinated care, care that really resonates and meets the needs of patients and families, then you're going to need that entire skill set. So figuring out how it is that we get at communication skills, for example, or figuring out how we get at whether or not a doc incorporates the feedback that they get from patients in the way that they design their care or deliver their care or recommend treatment. Those are tricky things.
I think we'll be looking not just at physicians' clinical knowledge, not just at their ability to retain and use information, but at their ability to treat patients as whole people, to really understand the life circumstances of those patients, to be able to skillfully understand and elicit the goals that the patient has, the experiences of health and functioning and well-being that the patient has.
I think as a group, and this is something across generations, physicians want to know, they want to be the best, they want to compare their performance with other people's performance, and so things that are embracing that, I think, are likely to be very popular.